Thank you. Good morning. Darinda Dick joins us today. She is the CEO, Western Missouri Medical Center.
Good morning.
President, whatever.
Yeah, good morning.
The boss over there, I guess. How you doing, Darinda?
I'm doing great.
Haven't seen you in a while.
I know. We had a little winter illness, but we're all better.
Okay, good to see you again. What's going on at the hospital? Is it calmed down?
We're still busy, but as far as COVID goes, yes, that's very calm.
That's kind of behind us now.
But we were staying busy. I think through the pandemic, we grew a pretty significant service line of being able to keep intensive care patients, and so we're keeping a little bit sicker patients, not COVID related, but just our abilities, which is good because Dr. Plume, our pulmonologist here in town, he's an amazing critical care intensivist, and we have backup with Dr. Vidaya for him, and so we have 24-hour coverage with critical care specialists. So that has been a new service line for us, I think, really, that's grown since the pandemic. And so
there are some positives that have come out of this.
Absolutely.
Learn to do different things different ways.
We had to put together the resources. We already had Dr. Plume. He is, more than capable, but we had to, have the staffing, the expertise in nurses, the backup for him with Dr. Vidaya. And so when you couldn't transfer people to Kansas City, we were forced to rise to the challenge to care for the patients. And so that has been a real bright spot for us.
Did you ever get so full you had to turn people away?
Once in a while. You mean recently?
Yeah, well, in the last 2 months.
Just recently, once in a while, if we're very, very full and we have a really high ER day, like I think one day last week we had a couple patients that were boarded in the emergency department waiting for a bed. There's a potential that day some people did get transferred to Kansas City just because
you do have an arrangement to put them somewhere else then.
Absolutely.
Okay.
Yeah. So that it happens on occasion. But we're busy with surgeries. Our orthopedic surgeons, Dr. Rupp and Dr. Whitgren, are actually doing more surgeries than they used to, and we're doing a lot of total shoulder surgeries. We're actually getting ready to apply for certification for total shoulder with the Joint Commission. They're already certified for total hip and total knee, so they're expanding their abilities, and we're looking at the latest technology around expanding orthopedic surgery. So, surgeries are busy. We do have that new general surgeon, Dr. Newells, who came to us and started at the beginning of January. He's a general surgeon with Dr. Machikow and Dr. Ghazali, and he has just hit the road running, and he's doing great. So when surgeries are busy, then it fills your beds.
Yes.
So there's a lot of management that goes into making sure that we have enough room for the people that need to be staying the night in the hospital.
What about urgent care over there?
Express care is still busy as can be.
Express care is what you call it?
Yep,
Okay,
it's still busy as can be. It seems like no matter how long we're open or how many spots we make, that fills up. So it's a really nice service for people that don't want to, think ahead, try to get in their doctor's office. It's convenient if they utilize the system. So.
Okay, now, how about your new facility downtown? There by the courthouse.
Yeah, Redefine, our med spa. We opened that December 1st. We are doing very well. It's starting to get busier. I watch the statistics every single day, and we're consistently seeing, 10 to 15 clients a day for different services. We have several services that we offer down there. Dr. Ghazali is the medical director. She's really passionate.
She's kind of busy now.
She is busy, and she's really passionate about it, and she really has been helping people to feel better, look better. We do have some functional wellness type things down there, IV hydration, and we have an Emsella chair, which helps with pelvic floor strengthening, that helps with stress incontinence and those kinds of things. So some things that help people just live a better life. And then we have some other things that help you relax and take care of your mental health. We have facials, we have some skin care regimens. And so it's a very neat place. The 3 ladies that work there every single day are delightful. I get nothing but compliments about it. I think we did a good job with the space. We rent that from Fairway.
Yeah.
And we totally remodeled it to make it fit our flow. And it's a cool little place. I get lots of comments of that exact thing, saying this is a pretty cool little place.
Do you have any men take advantage of that place?
Absolutely. We have men that come in.
I would think it's more for women, though, isn't it? Or not? Am I
wrong?
Well,
we were trying to hit the men market because so if you go there, it's not all covered in pink and and rhinestones.
Yeah.
It is an urban look. We have exposed brick and, just
Yeah.
a more muted color palette so men feel like it's not just for women. But IV fluids, obviously that can be man or woman. We do have, I have men that get facials. We have men that
Really?
men do like to take care of themselves nowadays, Woody. And I think it really is for a relaxation thing.
Yeah.
And then we have some body sculpting, actually the best technology in body sculpting with our M-Sculpt machine, and we have some men clients that are doing that. So, so we are planning to expand to do some hormone replacement therapy there, which would be mostly targeted at men.
I mean, I could go in there and work on these abs.
That's
right?
absolutely. We can take care of those abs for you.
I bet you could.
So-
Be a job, I'm telling you.
And they'll start being open on Saturdays, the first weekend of April. Mostly for just walk in, make
Yeah.
appointments. We will be doing some things by appointment, IVs and facials on Saturdays, but we have 2 late evenings, Tuesdays and Thursdays. We're open till 7. So
So it's becoming a busy place then. No?
it is. We're getting ready. We are getting ready to add weight loss with a wellness program
Yeah.
there, which is really popular at every other med spa in America. It takes some time to get those protocols in place. Dr. Phelps, she's a board certified bariatrician. I don't know if everybody knows that, but Angie Phelps is really well trained in weight loss and wellness for people. And so she's helping, she will be leading that program for weight loss. And she has her own weight loss clinic at Central Family that she runs every Thursday. But this will be just an extension that she'll be overseeing at the med spa. So.
Okay. Anything new coming up at the hospital we need to know about? What's going on there?
Well, yes, we have this big event, the Amerigazali champions.
Again,
It's called Blue Ribbon Bash. It's a colorectal cancer awareness event. It's March 30th. It's at the MKI Event Center Pavilion, the
yeah.
old White Rose.
Yeah.
So this is what we're trying to recreate sort of is colon cancer is the third leading cancer with the exception of skin cancer. So colorectal cancer really is a big deal. And we have a really large business of doing colonoscopies, EGDs through our general surgery department. So Dr. Ghazali, Dr. Newells, Dr. Machkow, they do a lot of endoscopy. So you don't necessarily need a GI specialist to just do your regular routine screening, right? But we do catch cancers at doing those screenings. And the new recommended age is 45. And not everybody knows that or wants to do it. It's not the most pleasant experience in the world, although I actually loved it. It was a great sleep. Great sleep.
I slept well during mine.
Yeah, it was great sleep. I felt very refreshed and fresh and clean as a daisy.
Yeah.
And so it's not a terrible experience. We do a really good job with it. And so we really want to increase awareness of screening to help catch colon cancers earlier in our community. And so this is our second year. It's gotten bigger. Like we had it in the lobby area of the hospital. Now we're getting an event space. This is sort of the beginning of what we did with Ladies Night Out. So, Ladies Night Out 10 years ago was in our lobby.
Yeah.
And it was, 50 people. And now, I forget how many hundreds of people come to that, 600, I don't know. And we have it at the now.
A lot.
So it's huge. And it really is all about breast cancer awareness and early screening. And we've done some tremendous work around getting early mammograms, mammograms to catch early diagnosis of cancer. And so when we started that 10 years ago, it was in our data that we had a lot of late stage breast cancers being caught in our community. That was in our actually public health data. And so we knew we needed to do more mammograms. It's the same thing. We want people to catch colon cancer early. We feel like that's a really big responsibility for us for this community. Dr. Ghazali is very passionate about it. And so we've created this new event.
Yeah, it started years ago was 50, at the age 50.
Correct.
But then about 2 years ago, they moved that back to 45.
Yes.
Is it still every 5 years?
It depends what they find.
They find a polyp every year every time they do mine. So I come back every 5 years. I just wonder when that will quit.
It probably won't ever quit. They have, there's national guidelines that they follow, and they actually have to document, why and when you have to come back. That's actually part of a value-based process that we have with the government. So it's probably one of those little quality measures that goes into that 5-star quality award we got from CMS. I am certain is our compliance with the regulations around colonoscopy follow-up. So it's just one of those things that we report to the government that says, and so we have to audit charts to make sure that the doctor is assessing using the right criteria and saying, this person doesn't meet to come back annually. It's every 5 years because of XYZ. And so they have to put that in the documentation. So anybody that has one should be able to get a copy of their report and see why the recommendation for when they follow up. But
But anyway, you start at 45 now instead of 50 and go every 5 years is the way I've been doing it anyway.
Well, I do not have this memorized. But there are people that have to go more frequently.
Oh, there are. Okay.
I feel like 5 years.
A lot can happen in 5 years, can it?
Yeah. I actually keep thinking that if they don't find a polyp, there may be a little bit longer than 5 years interval.
Okay.
But there's like 3 different intervals. I don't know this. So do not listen to me on that.
If you haven't had one in a while, go get one.
But Dr. Carper, Dr. Snowden, Dr. Brewington, locally, those are 3 physicians outside of the general surgery group. Was just Dr. Newells, Mochkow, and Ghazali. Those 6 physicians here in this community provide colonoscopies. And so Dr. Snowden and Dr. Ghazali are the 2 that are speaking at this event.
Okay.
Dr. Carper has a huge practice for this. Actually, he's one of our
He's
busiest.
done mine for years.
He's one of our busiest, and so it actually really is a good experience. We have great GI lab nurses, and it's not a terrible thing. People should, and the prep's easier than it used to be too. They used to.
It's not bad at all.
They used to
make
give
it
you
worse than it is, I think.
Well. Historically, they used to give you this big old jug, 2 gallons worth of yucky stuff. It's not like that anymore. It's either a very small amount of liquid or some pills, and then you're ready to go. So I don't want people to be scared of it. And if you come to the event, you'll learn all about it. You'll hear all about it.
And if you're afraid of pain, there's no pain with it.
There's zero pain.
Yeah, don't even feel it. Nothing.
Yep.
Because you're sound asleep, having a good time.
You are sound asleep. That is something that we do here. We actually have anesthesia providers that do moderate sedation for all of our colonoscopy. That hasn't always been the case. We used to just give IV sedation, and it was like you weren't quite as deep as you are now. And now we do what really is the most comfortable for patients, and it's the standard. That's what you're going to get at any big GI lab in the city. So we try to keep up with the best things for patients and the latest evidence around how to do that. But we do have an anesthesia provider right there at the bedside, keeping you nice and comfy.
What's down the road? Anything in particular you're working on now, adding to the services?
Well, I don't know if I mentioned this before, but we did have a new urologist start at the beginning of February, Dr. Morris. So he started at the beginning of February. He's had, I think, 2 or 3 clinics now. He comes every single Monday, and he sees 30 patients that day. He's going to be doing surgeries down here. So that's a huge service for us because we do have a lot of urology needs, which I know people don't realize, but lots and lots of people need urology for lots of different things. And so that's a really great service for us. And we have maybe an opportunity to get a little bit more urology in this community. So I'm working on something with that. And then we also recently contracted with a hand surgeon from Kansas City. His name is Dr. Palmer, Alex Palmer, and he is a hand surgeon. So that's a play on words, right? But that's his name, Dr. Palmer. And he starts March 3rd. Is it past March 3rd? He started.
It is.
He started Friday, and he will be doing, carpal tunnels, which we already do some carpal tunnels, but he can fix any kind of hand thing.
That?
He's a hand. I don't know if he can fix it. I'm not a hand surgeon, but that is the doctor you would go to say, "Hey, look at my funny finger."
Yeah.
So he's an expert in hand and arm, and so he right now practices in Kansas City. He is one of the hand surgeons on call for trauma in Kansas City. I mean, it's a big deal. So if you get hurt acutely in our community and we ship you to the city, he could be one of the guys that sees you. So he's very skilled. He is going to just be adding some of specialty to our orthopedic clinic. That is one of the things that we send out commonly to a specialist in Kansas City, and so he'll be doing some. He does carpal tunnel surgeries. Our guys do carpal tunnel, and that's in their scope, but he does it a little bit differently. He's a specialist, so he does it endoscopically, and he says that there's some new procedures coming where you can do carpal tunnel surgery in the office, and so he's bringing us like the best, the latest and greatest. And so
When is he here?
every Friday, or no, 2 Fridays a month right now, but
Two Fridays
it'll
a month.
it'll probably
At the
increase.
hospital?
Yeah, at Bone and Joint, right there in our medical office building.
I may have to see him. That's why I'm
Yeah,
asking.
go see him. Yeah, he's actually a really delightful guy. So
Good to see you.
nice to see
Yeah, been
you.
a while since we've had the chance to chat, so thank you very much for coming
Yeah,
today.
thanks very much.
You bet. Darinda Dick, she is the CEO, President, Western Missouri Medical Center.